best thing about being a GP. You just don't know when you're going to see something that's quite rare, quite interesting, and when there may be something quite serious coming in.
We need to get you seen by the hospital specialist. You need to make sure you're not missing anything.
Baby Frankie is having a heart operation because he has a hole connecting the left and right sides of his heart.
We have oxygen for him at home.
Yeah?
He's been in hospital for the last, 2-3 weeks.
The best thing about being a GP is the ability to help people and what you get back from patients.
How did it happen?
I pulled the door shut right on my leg.
Oh, I see.
Slammed it.
Oh, my.
I've been acting, I tell you. I've got all that hair. Every time I was trying to get some sleep, my back was popping like bubble wrap. Nine, it should have been.
So this is 10:50, that's 10 to 11.
Is that here?
I think so.
Gloria Wright, please.
Hi, morning. Come and have a seat.
Thank you.
Right, how can I help?
I've seen David Ward about this.
Right.
And he gave me some steroid cream, but it's done absolutely nothing. It's me ear.
Okay.
It's sort of bubbly, but it's really sore.
Okay.
And keeps waking me up. Because I normally sleep this side, but when I turn over, I don't know.
Right.
And I just want to get rid of it.
Okay. How long have you suffered with this?
It's been about 2 months.
Okay. Let's try and see if I can help you for this. So there is a sort of a dry area, and that's tender, is it? When I touched it. Okay. And then is this tender at all? This bit here? No. Okay. Just check behind your ear.
It's literally just that little bit at the top.
You can get these sort of hard, because you've only got cartilage, very, very thin skin in that area of the body. Can I compare to the other ear?
You can. Let me get my hair out of the way.
So you can get sort of this development of these sort of horns sometimes.
Don't say that. People already think I'm a witch.
No. Okay, so what you had was a weak steroid. Do you remember I gave you something called Elecon in the past?
Yeah.
Did you apply any of that on there?
No.
Okay. It's not definitely going to say it would make it disappear, that sort of hard area of skin, but I want to see if it makes a difference. I'm hoping that this is more an inflammation of the skin sort of at this stage. I think it was suggested it could be a wart, like a seborrheic keratosis, but you can get this something called chondrodermatitis. There's a long name, nodularis helicus, where you get this sort of dry, hard bit of skin. In extreme cases, they can cut them out and do things, but we'll try the Elecon once a day. So there's some information there. That's useful, actually, printed out.
Lovely.
All right?
Great.
So if you're not happy, come back and then we'll meet again.
Brilliant.
Yeah? Nice to see you.
Thank you.
Take care.
Have a good day.
Thank you. Bye.
How can I help today?
Basically, came for a GP appointment with Dr. Mackey. What happened was, so came in, obviously, found, spots of blood in my urine. And then, went for it. She referred me to the urologist, and there was a tumour. I had a tumour in my bladder. I think it's cancer and everything. But, I had it taken out.
You've had it taken out?
Yeah, I had it out on Friday.
And when are you seeing them next in terms of getting the results of the biopsy and things?
18th of this month.
18th, okay. And has the blood basically resolved now, or?
Blood, well, no, even that hasn't, but that's more because, I've had a...
You had a camera in
a
procedure.
The thing out, so...
Fine. And you've been off work, is that right? for this.
Yeah.
Yeah. How long have you had off work for this so far?
Well, I had a couple of days off holiday anyway, so I've only actually taken Friday off sick.
Mm.
So
And
it's just where I've got like an active job. I feel all right, but
are you planning to take more time off? Are you going back to work? What are your plans?
if it was like a office job, I would go back next week. But where I'm an electrician, like I don't know.
It's a bit more physical.
Yeah.
Yeah.
I just don't want to like I feel all right, but I don't know.
Should we sign you off for a week?
Yeah, sure.
And then go back and...
Yeah.
I mean, obviously, any further treatment depend on the results, really, of what was taken out. All right, we'll see how it goes on the 18th. Take it from there, really. Yeah.
All right.
It's unusual finding in a 30-year-old, I must say.
Really?
Yeah. I'm sure they've told you that in the hospital as well.
Yeah, I know.
So, it might be benign. We don't know that, really.
So, yeah, hopefully it isn't. But the thing I'm not looking forward to is like every 3 months having a cystoscopy. Like, it's absolutely filling me with dread, but it's got to be done, isn't it?
All right, you take care of yourself. All right.
Thank you.
Hello, Terence.
Hello, Dominic. Can somebody sort something out about your toilet?
What's wrong with it, my love? We don't even get a chance to go in there.
No, it pinched my bum. With all the money they're going through here, you could at least afford a new toilet seat. I'll buy it. My toilet seat's broken.
Right, we'll put a note.
Pinched my bum.
We'll report it.
I'll report it for you.
After we've all sat on
I've
it.
known my bum pinched for years.
Hi, come on in. I think I've met Frankie before. I think I came home to see him once.
Everyone's met him.
Yeah.
Everyone.
He's Mr. Popular.
So, he's been quite sleepy at home, like sleeping quite a lot.
Okay.
He hasn't done any poos in the last couple of days.
Okay.
And we have oxygen for him at home.
Yeah.
He's been in hospital for the last 2-3 weeks. With his mum.
Frankie's suffering from a genetic disorder called chromosome 3p deletion syndrome, which is a very rare genetic problem. Genes are the bits of code that make us who we are and tell our body how to grow and develop. And unfortunately, in Frankie's case, he's missing some of this code, which can lead to some problems in the way that the body functions.
Yeah. And it's christening on Saturday, so we just want to make sure things are nice.
Yeah.
So we don't miss it.
Of course, yeah.
He's supposed to be having his open heart surgery next week.
Right, okay. Okay, so a lot of important things coming up.
Yeah, but I'm not sure if that's going to go ahead because Great Ormond Street said they haven't had the pre-op assessment. I think people haven't spoken properly and it's been sort of screwed up.
I guess it's quite a complicated case, isn't it? So there's lots of people who need to speak before this sort of thing happens. Okay. Baby Frankie is having a heart operation because he has a hole connecting the left and right sides of his heart. He also has a narrowing of one of the arteries that leaves the heart, and so this needs to be surgically repaired.
I believe she's got a urine infection or something. Looks at the symptoms online, Dr. Google. Yes.
Have any problems when you're passing urine?
No, but it's just stinky.
Right, okay.
Can you go and do a urine sample for me?
I can try.
When was the last time you opened your bowels?
So it's when she wheezes, she cries, and she was like holding this area here.
Very lucky that the loo is just opposite. Okay. See you in a second.
Right, so we're going to do your diabetic bloods?
That's correct.
Yeah. Did you bring a urine sample with you?
Well, can I tell you something now?
Go on.
I was about 2 or 3 weeks, well, 2 or 3 say appointments ago.
Yeah.
I brought my urine sample, and I was told you don't need that. Oh, why don't we need that? Well, we don't do it anymore. Now,
I think it's a case of the blood work. We grab everything from the blood work, and obviously we do use the urine to check the glucose in the urine as well. I think the urine is more sort of old practice.
Correct.
But it's still a practice we like to do. So.
Well, I'm damned.
Yeah, essentially. I mean, it's always good to have the urine sample.
Well, yeah, I would agree with that.
Yeah, I would like a urine sample if you could do one for me.
Well, I'll give it a go.
You a ball, yeah.
Well,
do you want to go after and we'll do the bloods first? And,
well, you can do. Well, you've got to be doing something, haven't you?
Right, okay, let's grab a pillow. Pop your arm on something.
You assumed I was going to give you my left arm?
Maybe. Closest to us, but there you go. I saw this big bulgy vein, and I thought that's what I'm going for.
You don't sink your teeth into it, eh?
No.
No, all right. Do I get a sweetie after this?
Yeah, and a bag. I got a badge as well, sharp scratch. Little sticker. So, if I give you a bottle, maybe you might need to run the tap, who knows?
Where's the toilet? Out there somewhere?
Yeah,
is
just go past the waiting room and it's just there on your left.
Oh, right.
Big handle. All right.
Mr. Victor Dell? Hiya. Have a seat.
I'm out of work a bit quick, so sorry I'm a bit dirty.
No, that's okay. That's no problem at all, sir. I'll just introduce myself. My name's Vijay. I'm one of the clinical pharmacists of the practice. I've just brought you up. So you're here for a medicines review, sir?
Am I? Okay. That's what you say.
Okay. So you take a few different medicines for different things. Diabetes, blood pressure, cholesterol. Is that correct?
You say so?
Yeah. I think, yes, some of your medicines have expired, so that's probably why you're here for review as well. In terms of your medicines, how have you been with those? Are you taking them regularly, sir?
Yeah, every day.
Yeah, okay, brilliant. Now, diet-wise, are you conscious about what you have, or...?
Don't tell me to lose weight, because it's not happening. Tell you that now.
Okay.
I don't eat that great. I eat fish, chicken, diet drinks if I have any. Trouble is, I can't exercise. I've got nerve damage in both my legs, which I go to the hospital quite often to have epidural jabs with steroids in and that.
Okay.
I just can't swim, I can't ride my bike now, I can't go out for long walks.
Okay.
Can't do sit-ups, nothing like that, so...
All right, so that you can't restricted with that.
It all depends what goes in my mouth.
Yes. Do you have alcohol, sir?
Yeah.
How many?
As much as I can get down my neck.
Do you smoke?
I do, but I've got onto the vape, and I'm down to about 3 now.
Okay, so you're looking to cut
Yeah,
down.
I'm trying to stop completely.
So we need to kind of look at how we can bring this blood sugar down. Try and stick to fiber and stuff. It's more filling, it's more healthy, saturated fats. From a tablet's point of view, glycoside, we could probably look at adjusting the dose to see if we can bring the blood sugar down. After that, we would probably have to consider insulin at some stage. I don't know what your thoughts on that is.
No, I'd rather go without that.
Yeah, no, it's...
It ain't going to happen, I only live once. If I'm going to die next week, I'll die, don't worry about it.
That's fine.
Definitely.
Okay.
I've got to be on death's door to take that, and I might only be here for another 5 years anyway, I'll be in my box by then.
Okay, not to worry. I'm sure you live much longer than that, sir.
I very much doubt it. You don't live with my wife.
Okay.
There are 2 people who are due to arrive from me at 2:15. I'm just going to visit and I should be back.
Okay, John, there's waiting room for you.
Or in the boardroom if it's empty by that time.
Dwayne Fernandez. Come in. How can I help?
Give me 1 second. Doctor, as you know, I'm diagnosed with Crohn's disease.
Yes.
Okay. I used to see Dr. Diore regularly. Yes. She wasn't available today, so I've come just to see herself today. I had 5 periods of loose bowel movement over the 2 days yesterday. Yesterday was 5 a.m. and 5 p.m.
Yeah.
And today was all in the morning, 3 a.m., 5:30 and 8:30 in the morning.
Mm-hmm.
A bit concerned, obviously, because that has just come about now.
Yeah.
I'm on steroid medication, and that's prednisolone after being discharged from hospital. I've got letters here.
Crohn's disease is, in essence, an inflammation of the bowel. It presents generally as diarrhea, and sometimes blood in the stool, a bit of weight loss, abdominal pain. It's a difficult condition because there isn't actually a cure. I think we're betwixt and between here. Do you understand what I mean? We're waiting for starting the new medication called Humira.
Humira, H-U-M-I-R-A.
Yeah. And I think that's good news because it sounds like your Crohn's is not properly controlled at the moment.
No.
We need to wait, okay, until you start this. When patients are under the care of specialist teams, if they come to see the GP in the middle of this, it can actually be quite difficult. You want to give the specialist team free rein to manage. That's why they've been referred in the first place. And so there can be some difficulties when managing patients in those circumstances of shared care. The problem with Crohn's is when it's not behaving itself, it can be very difficult for patients. And I think we need to wait until it's...
Wait for the blood test results and then see how that's
I would wait, yes.
All right, sir.
Okay. Any worries, come back and see us.
All right. Okay.
Okay.
Thank you very much, doctor.
Cheers. Take it easy.
Doctor.
Bye-bye.
All right.
Bye-bye.
Have a nice day.
Bye-bye.
Come in, grab a seat, Mr. Hiles. I've got a student with me today, if that's all right. Grab a seat. Right, what can we do for you then?
My knee is getting worse. My osteoarthritis.
Uh-huh.
The painkillers I'm on, it just ain't doing nothing. I can't work or nothing anymore.
What do you do for a living?
Bricklayer.
Right, OK. So you need to sort of use yours. Is one knee worse than the other?
Yeah, it's only in the left one.
It's only in that one?
Yeah.
Did you injure that one in the past or anything? No. OK. And
you know when you get a toothache and nagging.
Yeah.
It's like that constantly.
If 10 is 10 the worst pain you can imagine, and no, it's no pain. Where does it lie between those two?
Well, I'd say 9.
9.
Yeah.
And when does it get worse then?
It gets worse when I bend my knee.
Yeah.
When I'm upright,
yeah,
it's fine.
Okay. When you're walking, is it okay?
Ain't too bad, yeah.
Yeah.
But it does nag.
Can you just slip your trousers off and let us have a little look at it and see? Okay, let me have a look at this one too. Oh, right, let me just see. Right, just relax for me. Relax. Okay. Oh, sorry, yeah, we can get that. So.
It tends to hurt
up around here, does it? Yeah. Okay. Up that way?
Up here as well, more.
What painkillers are you taking at the moment?
The last ones they give me, I've taken them, but my wife says it makes me irritable, moody, and it don't agree with me whatsoever.
We gave you some cocodamol, but also some tramadol a while back.
That's right, yeah.
The tramadol can make people a bit sort of strange, a bit funny, a bit irritable.
She said it was making me irritable, nasty, and aggressive.
Do you get problems with your stomach or anything?
No.
Okay. It's been a while since you've had your knee x-rayed, so we'll need to get another x-ray, and then we can look and see what we need to do. Let's get you some pain relief, and then we'll review the whole thing together then, okay?
Thank you very much.
All right?
Thank you very much.
Okay, take care then, and we'll see how you get on. Okay, look after yourself. Bye-bye.
Susan Edwards, please. Hi, Susan. I've got a medical student with me today. Come on in.
She's got a loan.
Thanks for waiting. Dr. Tawana, nice to see you. I think I've seen you guys before, yes. How can I help today?
I keep getting headaches.
Okay.
I've had, I don't know, MRI.
Okay.
This side doesn't really want to open. They admitted me last June because they thought I had a stroke.
Yes.
It turned out they said I had a Horner.
Right. Horner syndrome is where you've got a trio of symptoms. Those include one of your upper eyelids drooping, you have constriction of one of your pupils, and you can also get loss of sweating to one half of the forehead.
It's come back again. I've had a headache now since Sunday.
Yeah.
The weakness has come back.
Right.
I can't. I'm a mess.
So, important questions that I need to check with you. Any fevers, any rashes that have come out of the blue? Any vomiting in the last few days? Good. This headache that you've been experiencing, allowing you to sleep at night? Waking?
Well,
Sort of. Yeah. Okay. With Horner syndrome, there can be lots of different causes. To name just a few, you may be thinking of things like multiple sclerosis, tumours in the brain, inflammation of some of the arteries of the brain, herpes, zoster or shingles type infections. My immediate thoughts would be, I think we need to get you seen by the hospital specialist, just because potentially we need to make sure that we're not missing anything.
How can I help?
Right, well, first off, it's actually, since I spoke to you, it's gone down, weirdly, but it has a lump.
Okay.
Just underneath there. It was the size of about a 10p piece.
Okay. And did you have bruising over this, apart from this one? Did you have
yeah,
any
it was
other
great,
bruise?
huge black.
Oh, how did it happen?
Well, you see, we left the motorhome site and we forgot to turn the gas off, so she stopped. I got out and I pulled the door shut, and I pulled the door shut right on my leg.
Oh, I see.
Slammed it.
Oh, my.
Yes, it was rather loud.
Trauma.
Yes. So the lump was sort of quite big.
How long did it take to swell up?
Well, it sort of did it straight away, practically. So
So that's a hematoma.
Yeah.
So that's a collection of blood, and so it's getting smaller all the time.
Yeah.
Yeah, and it's still there.
Yeah.
But it'll eventually get small. You might have a little nodule left at the end of it,
Yeah.
just as kind of this marks the spot
marks
at which
the
you
spot
shut
where
the
you
door
shut
on
the
your
door
leg.
on your leg.
Did you rest it or put ice on it, or what did you do?
Well, no, because we didn't have the sort of ice or anything like that. So I was just sitting in the cab in pain.
Well, any form of ice, even frozen peas or frozen vegetables, go into Tesco. Take the frozen vegetables,
just sit in the fridge.
Buy them, And
just a minute.
Yeah.
Don't mind me. I'm just.
Yes, I'm just treating myself. My doctor said I could do this.
I could go into Tesco's.
Yes, no, I'd advise you to buy them first, and then use them.
Okay, that's a good idea. Next time I do something stupid like that. All this typing, you haven't learned to do it with more than one finger, then?
No, sadly. You're pointing out one of my inadequacies.
Well, you obviously haven't got many, you see, so...
I was going to say one of my many inadequacies. Yeah, you got there before I did.
Okay, brilliant.
Nice to see you.
I'm going to just check some of the nerves that come off the brain, just to see how they're functioning. So what we're going to get you to do, focus on my finger, and as I move the finger in closer to you, just keep following the finger. Here we go. Great, OK. Now, keep looking at the finger. I'm going to steady your head. Keep following it, just your eyes now. If at any point you see double, please let me know. Good. 2 up here. OK. Clenching your jaw shut. And then open and clench. Good. Can you hear this? Yep. OK. There is that little bit of weakness around the eye muscles on the right-hand side there. You're seeing double in the corner of that right eye. Are you happy for me to speak to the hospital team? I think we need to get you seen. And it does sound like it could be a Horner syndrome, I think, the Horner syndrome again. Yeah, you had that last year.
Put me in overnight.
OK, fine. Oh, hi, my name's Dr Tawana, GP at Farnham Road Surgery, Slough. I've got a patient, 60-year-old, in the room with me, just a bit concerned about a headache that she's developed. That's lovely. Brilliant. Thank you very much for your help. Cheers, bye now. OK, so I'll do a kind of a referral letter. They will see you in the ambulatory care department, which I think is next door to the A&E department, so if you go straight there. Today, yes, they'll be expecting you.
I haven't wasted your time by coming.
Not at all. No, definitely not. We need to get you checked out and seen. OK. Good luck up there. You're welcome. You're welcome. Take care.
Good service?
Yes, it's good service.
Kept you waiting, but we got what you needed in the end.
I've been up here, well, this one is nearly 46, 47 years with the Farnham Road.
And today is the best service you've ever had.
Oh, good. Very good. Everybody is nice to talk to. I used to bring them some sweets up here because I worked in that one.
Oh.
Yeah,
We don't need
but-
sweets.
Oh, no, but it was my gesture.
Oh, that's so lovely. Thank you very much.
Thank you very much for it.
You're welcome.
Thank you.
Take care. See you soon.
Mr. Adawi? Roy Adawi? Sorry for the delay. Come on, have a seat. So, it's been a while since we met up.
Yes, yeah.
So, how are things with your back pain and...
Still terrible. Absolutely terrible. Sometimes I don't sleep for a whole night or something, you know?
Main concerns were with respect to your pain relief. And I can see the King Edward's Hospital Pain Clinic invited you for the
living with pain course.
Yeah, I could only make
2 out of 9 sessions.
Yeah.
Why was that? What happened there?
It's getting there, and you sat there for a couple of hours. I know you have a break, but sometimes the pain just, well...
I would seriously advise you to attend that.
Yeah, well, I got a letter from them saying they will invite me back.
That's right. One of the main concerns from the pharmacist who was reviewing your medication was that you had a slurred speech, and it was also concerned about the tramadol usage. So what do you think about your overall tramadol usage? How much are you taking nowadays?
Well, up to 8 a day. Sometimes if I wake up during the night, or, then I'll take a couple more to try and, help me.
Yeah, 8 is the maximum though.
Yes, yeah.
One would advise, not more than that.
No, I have taken like 10.
I would certainly advise you to cut down on that.
Only very occasionally.
Any other substance that you're using that might cause you slurred speech and confusion at times or anything? Alcohol?
I have a drink now and then, not excessively. I don't do any,
Any other drugs, yeah.
No, not recreational drug taking or nothing like that. Never have done.
You smell of alcohol. Have you been drinking?
Ronald, booth, please. We're upstairs. Is that okay? Yes, just the nurse. Come in, take a seat.
Thank you very much.
Come on through. Sorry, it's a bit warm in here. How can I help today?
I still have the pain with the passing of water.
Right.
But it's not as bad.
Okay.
And the tablets run out today.
Right.
And he gave me a 7-day course.
Yes. So how much better is it?
I'm going to the toilet both ends, and my wife's giving me lots of fruit and telling me to drink lots of water, and that's helping as well as the medication.
So you said it was a bit better. Is it, 50% better? Or?
About 50, I would say.
Okay, fine. And do you keep needing to go still?
I keep getting the urge.
No blood that you've seen?
No blood, no.
Okay.
But I did, I know I shouldn't do it, but looked at Google.
I did tell you
and I looked at this. I don't know whether that would help.
I have to say, I've never heard of these before. I mean, it does sound very convincing of a urine infection, which is the most common cause of those symptoms.
Yeah.
And the fact that you have had some improvement with the antibiotics would also suggest that it's probably infection, because if it wasn't, I don't think the exactly wouldn't have made any difference.
Because I did wonder whether it could be stones.
Generally, with stones, you get a lot of kidney pain on one side. And kidney stones wouldn't improve with antibiotics either. So I think, all in all, I'd probably recommend extending the course of antibiotics, because you're almost there, but not quite. So I think probably another week should do it. Drink plenty of fluids as well. If you're still not better by the end of the course, it's probably worthwhile seeing us again. Is that okay? All right.
Thank you very much, Dr.
Yeah, I've had 2 drinks today.
2 drinks, yeah. Do you drink the whole day?
No.
You're on quite a few medications. I wouldn't advise you to binge or take alcohol excessively. How much are you drinking daily basis?
I might have, I've had 2 today.
2 pints of beer, or?
Yeah, beer, yeah. Not strong stuff.
Clearly, that's something we need to keep an eye on.
I am under some pressure at the moment, financially.
Okay.
And stuff, and I'm starting to feel...
That's taking an effect?
Yeah, I have some dark days sometimes, I'm under increasing pressure all the time. Trying to sort out where I'll be.
Yeah.
Maybe in 4 or 5 months' time,
Okay.
Whether, I can stay on where I live, or whether I've got to go to the council.
Okay.
And beg them for a place, but that's not easy these days, is it?
Yeah.
I mean, no one's going to employ me. I've applied for some jobs in the past. You're lucky today if you get a reply, from a
That's
company.
fine.
So I just feel washed up, wasted, and stuff, and it's really putting pressure on me.
True.
I don't know what to do, really. It's feel like I'm trapped.
Shall I arrange for some talking therapies to help you with?
Probably can do with speaking to someone. I think, well, it's going to be a help to me.
Fine. Let me arrange that for you. We will keep an eye on the usage of the tramadol and we will try supporting you with your pain and your mood gets better, okay?
I'm worried about both.
That's right. And I would regularly see you from now on. All the best, sir.
Right, lovely. Thank you ever so much.
Good to see you after a long time.
I'm going to go back home now.
Keep moving.
Yes.
All the best.
Yeah.
Take care.
Okay, Dr.
Bye-bye.
Bye-bye.
Cheers.
I'm Dr. Shree. Have a seat.
Right. What it is, I need a written prescription. I've just come out of, from Wexham yesterday. I'll show you, let me show you what the problem is first before I start. I'm in agony here, I tell you. We've got all that there.
Okay.
All that there.
Right. When did it come up?
When did it come up? March. I had loads of little bubbles to start off with. And I went to, because I've got leukemia, I've been diagnosed with leukemia since 2006. I was in Oxford for 4 weeks in 2011. I was told I don't have the transplant, I've got about 3 years left.
Sure.
Because in the end, I had to have a bone marrow transplant. And everything was all right for about a year and then it come back again.
Has he been quite upset and miserable otherwise, or has he been coping with all this quite well?
Quite well.
Yeah?
He's happy baby.
Yeah, he's quite a happy baby.
Happy,
Yeah, okay.
The thing is, he might scream, right? He don't want the bottle, and the next minute he's like, and you try and put the ball there, and you push it away.
I do think you're such a happy baby, aren't you? Yes, you are. Okay, well, best of luck.
What's wrong? What's the matter?
They're very beautiful now. They get harder work when they get older, don't they? Good luck.
Bye. Come in, have a seat. Hello, I'm Dr. James. Morning, morning. Come in, grab a seat. Now, what can we do with Rhoda then?
She got burned. She burned her leg.
How did she burn her leg?
She pulled the kettle.
Oh, right, okay. Where was the kettle?
The teapot. I mean.
Oh, the teapot. Oh, right. Was it on the sort of table or where was it?
Floor.
On the floor.
Yeah.
Oh, right. Okay.
So I was concerned because of an infection.
Shall we have a look and see then?
Yeah.
Yeah. And let you take it off. What's this from? Okay, so they are nasty burns, but they're not infected. And you've sort of done a good job because they are beginning to sort of seal over.
Yeah, because 2 days I opened it and I left it under.
If you've got some Gelinet, it's worth putting a little bit of some Gelinet on again. What we ought to do is just check them again in about 2 weeks to make sure it's all settled down. I think this looks like a little reaction to something. You can see there's some little.
Just now
you could give her a little bit of Piriton solution, which is an antihistamine.
Antihistamine.
Yeah.
Okay, so.
I'll give you some of that. But I mean, obviously, teapots and stuff, you need to make sure that they're well away because at this age.
I just said to my husband that I'm gonna make another tea.
Yeah.
And I got up and she pulled it.
Yeah. Okay. Obviously, try and keep it out of your way because you're very inquisitive. Is she crawling and stuff at the minute?
Yeah.
What I'll do is I'll just get something just to cover that for you. Sorry, sweetheart. There you go. There we go. You just put Gelinet on as you've been doing that. Okay. With this, it's just 2.5 mils, half a teaspoonful, up to sort of 3 times a day, just to try and help with that little rash that's obviously she's reacted to something. Okay. Not at all. Take care then. Bye-bye. Bye. Have a good day, you too. Bye-bye.
Anyway, my back ballooned up, like really big round blisters.
Yeah.
And within those 2 weeks, every time I was trying to get some sleep, my back was popping like bubble wrap. Every time I lie down in bed, I was in a right mess.
Yeah.
Have you ever seen shingles like that before?
This is one of the worst.
That's what they will say.
There's been a secondary reaction on your skin, it looks like.
Anyway, they put me on so much medication. I went back to Wixom yesterday. Yesterday I was given it's a cream.
Yep, capsicum.
Is this? Do I just apply this to this?
Did they say not to put it on the shingles bit? I think you can.
I can.
Yeah.
It's going to be iffy.
It is a pain relief cream.
Oh, it is, isn't it?
But it's based on pepper, on chili. It's
Yeah, he warned me about that.
It can burn a bit, but...
It says it smells... Excuse me. Also, since I had this, I've been coughing up a lot of phlegm, as you can hear.
Yeah.
Is that a chest infection?
I'll have a listen.
Yeah, it's only since I've had this. God, I've been killing out so much muck, is the polite way of putting it.
I'm going to check your temperature. Just put this in your ear. What colour is it when you cough?
Oh, it's just white phlegm sort of thing.
So that's normal for you, that colour, is it? Okay. So it hasn't changed?
No.
But do you think it's more productive, this cough? Okay.
Sometimes in the evening, watching telly, I have to have an old disused cup by my side in the chair, because every time I cough, otherwise I'll be walking back and forth to the bathroom every 2 minutes.
Okay. So, sorry, continue my examination. I'll listen to your chest, if that's all right. Some deep breaths for me. If you breathe in and out through your mouth for me.
Oh.
That's great. It's painful when I...
Yeah, it's a nightmare when I have to put a T-shirt on and off.
Okay, fine. Listening to your chest, I mean, good news, oxygen is great. You haven't got a fever. But with the vulnerabilities and the fact that you're on steroids as well now, I think I would agree to cover you with some antibiotics. So that's there to, in a way, to protect you from these sort of situations, from deteriorating. But I will give you something called clarithromycin for chest infection. All right, that's there.
All right, okay then.
All right.
Great.
Okay.
Thank you very much.
Take care. Bye.
Hi, Connor. Come and take a seat.
Thank you.
How can I help, Connor?
Like past week, I haven't been able to sleep at night, like at all, and like my uncle was he gave me like he got prescribed some Valium and he gave me one.
Your uncle gave you a Valium?
Yeah, like I had it before, but they gave it for my back, but it helped me sleep before. But it didn't affect, and it's really annoying.
How many tablets did you take?
Just one.
What we say is, because you're very young, you're only 21, we don't want you to become addicted to these tablets. Borrowing other people's medications is something that we don't recommend, because if it's out of date, if it's not for you, you know, you're quite young, and...
Nah, he was just trying to help me out.
Yeah. So just to double check, have you had insomnia before, where you can't sleep?
Nah, this is like the first time.
And in this last 1 week, what do you think might be causing this?
I don't know. Well, I've started a work experience thing where, like, I start at 4 and finish at 10.
What work experience are you doing?
It's warehouse working. So you think that would make you tired? But
Yeah.
Like, I just can't sleep.
And your mood this week, you've not had any recent low mood or previous depression, anything like that?
No, I'm a happy guy.
You're quite happy?
I'm not like, I don't get depressed or nothing like that. No.
And alcohol and smoking, do you do those?
I don't smoke, but I occasionally drink, but that's like when I go out with my friends.
Sure. And do you take any other drugs?
No, I don't take anything.
What I would suggest is, drink lots of water and do something we call sleep hygiene. Get to sleep at the same time every night. Go to bed only when you are tired. Sometimes exercise is good, but not exercising too late in the evening. So with this new job, because it's kind of in the evening, it might have been changed. It's probably changed your kind of routine. Yeah.
Yeah.
What we could do is you can try things over the counter, or I can prescribe you something which is very similar to Nitol, called promethazine. It's the least addictive medication to help you sleep, and I can just give you, 4 to 5 tablets just for the next couple of days to help you out. You just take one at night.
Yeah. No,
Would you like to try that?
Yeah, that's fine.
There you go.
Thank you very much.
Okay. Don't take any more tablets, any prescription tablets of other people.
No,
All
don't
right,
worry, I won't. Hopefully I'll be sleeping properly soon. That's all right.
Take care, bye.
Okay.
Thanks very much.
No problem, you take care, okay?
Thank you.
That's for you. Fantastic stuff.
You're welcome. Good luck. Okay. Cross your fingers.
Thanks for coming in. Okay, panic over.
No, panic over.
Panic over.
All right. Nice to see you, Mrs. Davitar. All the best. Yeah. Bye.
Oh, that's lovely, thank you.
All right.
Ready for a dance now? All right.
Hello. You've been in the wars, have you? Literally. Right. So what happened?
I went inside this park. I was trying to jump over the fence when we were going out. So my foot got stuck in it.
Yep.
And I fell down on the hard floor. And I
Whacked your eye. Straight on like that, yes?
Straight on. She
Oh,
got
dear. Okay.
this injury over here, and it was quite swollen at that time.
Yeah.
But
When
at the
did it
moment-
happen?
On Sunday.
On Sunday. Okay.
Yeah. At the moment, it has gone all over her eye.
Yeah.
So I was
You can be hit over here, and you can still end up with a black eye. It's almost as if with all the tissue in the scalp and around the eyes, when it bleeds underneath the skin, which is what a bruise is, it's very vascular, so you get lots of bleeding, and it can track down through the tissue planes and will end up around here. So it's really common to get this, even though the hit was up here, often it will come down here. Now, what I need to do is just make sure there's no deformities of the bones. You're very brave. Okay, there's none of that. What I want you to do, okay, is look at my finger and just move your eyes to follow the finger. Can you do that for me? And what I want you to do is tell me if you get any double vision, okay? So head nice and still, ready, follow. Okay, only one finger.
Yeah.
Good. She's going to be fine. Okay. So there's no deformity of any of the orbit, okay? What we check for then is just in case sometimes you get a little crack inside the orbit and the muscles that control the eye can get stuck a bit, okay? So if that happens, then the eye doesn't move as well on one side, so you end up getting double vision.
All right.
I'm happy she's not.
Okay, so she doesn't have.
Yeah, so I'd keep an eye on it, just see how that goes. You would expect this to slowly get better over the next 7 to 10 days, okay? So it will change colour, it will turn into a sort of a deeper, then it'll go sort of a brownish colour, then it will fade away as the body absorbs that sort of blood back into it. But it may even look a little bit worse tomorrow. Next time, don't jump over that fence. Okay?
Thank you very much.
Bye-bye.
Bye.
Hiya.
I wonder if I could get an appointment to see the doctor.
A routine appointment, or is it something urgent?
Well, what it is I've just come away from the hospital. I went for an assessment for an operation on Tuesday, and I can't do it because my blood pressure's way too high.
Okay.
So they've given me a letter to give to the GP and get on medication straight away.
Okay.
I have cancer, and obviously I want to get the surgery done
Quickly, okay. I'll go and speak to a doctor and see if we can fit you in on the emergency list. Okay? Yeah.
Come in.
I'm going to scream.
That's all right. How you doing? All right? Good.
Why don't you and me get married? I'm out there so often, don't I?
Oh dear. Right, blood test. Okay.
I've had so many. I'm sure that not getting the right things, right.
No, it's fine. They're all different sorts, aren't they?
Are they?
Yeah, different ones that we're doing for you. There you are. Right.
If you hurt me, I will play out.
Oh, be on your best behaviour now. Nice straight arm like that. For
Okay,
me.
lollipop.
I haven't got. Look, I've got badges. I'll give you a sticker.
They always give something away, didn't they, to please the kids?
Children, not to grown-ups, Bill.
Shut up, Scratch.
But we never grow up with.
Oh, look.
I feel as if my life is now ebbing away down to a jar.
Oh gosh, you listen to it.
Oh, most men are really squeamish, aren't they?
Yeah, it's really bad, really. But then, there you go.
Oh, I don't have a baby.
It's not that bad.
Are you sure? Have you had some?
Yeah.
How many?
One. One.
Thank you very much.
What's that? Sorry? This is a BNP, which I believe it shows the level, to see if your heart's enlarged or not. Yeah, so is this to do with shortness of breath?
I've got a big heart.
Oh, I
Believe
bet.
me, I've got
I
a really
bet.
big heart. Would that show up if I've had a couple of beers today, a couple of drinks today? It won't. Oh my God, look at that. She's had a go at me on the way down here.
Have you? I bet.
I thought, oh God, I've got to go to the doctor's again. I had a beer, I had another beer, went into the greenhouse, I sat there, doing my plants, and I thought, this is lovely.
I'll have another one.
And then she arrived and she went, you haven't been drinking, have you?
Yeah, I bet, yeah. No, it's hot chocolate weather, not beer weather.
So
right.
that's it.
That's it. All done. Okay.
Thank you very much.
All right. Nice to see you.
You have a nice day.
And you. Bye bye.
The anaesthetist found my blood pressure was so high that he said he didn't risk and I needed to come to you straight
really?
away and
Okay.
get medicated.
Yeah, sure, let's have a look. So,
there's the letter.
what's the operation you were having?
Well, this one is only a bowel investigation. I've had 4 liver biopsies.
Yeah.
I've got 1 more liver biopsy tomorrow.
Mm.
But my bloods are showing very high for cancer again. I've had breast cancer, I've had node cancer, and I've had bowel cancer.
Yeah.
So they want to do, what is it, when they put the camera inside?
Mm.
And they want to do it while I'm out. And they're assuming probably that I've got cancer in the bowel again.
Okay.
So, yeah.
Ah, nice to see you. Just take a seat. Just over there. No, that's my chair. We know people who drink wine have fewer heart attacks than people who are teetotal. Say, oh, say off. Oh, that's good. Yeah, good. I mean, we could do a T4, but I think you have more important for fish to fry. How can I help?
The last 5 weeks, I think it is,
Yeah.
I've had ear infections.
Both sides?
Yeah, this one is just blown. I can't even touch it.
When did
Can't
it do
sleep.
that? Yeah.
Yesterday.
Okay. And did it bleed at all?
I don't know.
Mhm.
I can't even touch it.
Is there anything coming out of it?
I've been putting
Drops of some kind?
cod liver oil in it.
Olive oil.
Yeah,
Yeah.
cod liver oil.
Yeah.
Yeah.
Are you a cigarette smoker?
Yeah.
Okay. Can I examine the ear?
If you can.
Right.
It's going to kill me.
No, I don't want to kill. I don't want to kill you. On the other hand, I can help you best if I get examining it. Yeah. Have you been on any antibiotics for it at all?
In the last 4 weeks, yeah.
My, oh, it's really inflamed. Do you get eczema?
No.
No.
Never
Just turn around on the other side. How's this ear?
This is the one I was supposed to have had syringed today, and I said I couldn't do it.
Yeah, I'm sure you find it'd be difficult to bear it. Just have a look. But it's nice. It's much clearer and much less swollen than the other one.
Yeah.
I'm sure it's still so. Do you put cotton buds into your ears?
Only now and again when I clean them.
Mm. So before all this started, how many cigarettes you used to smoke?
About 5.
5. Okay. Yeah.
I'm not a heavy smoker anyway.
Yeah. Just open wide your mouth.
I can't. It hurts.
Okay. As hard as you can. Sorry. Now say good. Well done. That's good. Nicotine predisposes to ears, nose, and throat infections. Are you on any painkillers for this?
They give me antibiotics and that was it.
Okay. And
The strongest ones you got, I can take.
I can imagine. Yeah.
Oh.
Absolutely. Yeah. Okay. So either of these antibiotics might make you feel nauseated or vomiting. If they do, take one of the anti-nausea tablets. I apologise for the nausea or vomiting in advance, but there's no other substitute for this one that can make you a bit sick. I'm sure you do, but these tablets will make it better. And it's only about 1/3 of people who get nausea on this second one. But you need both, okay? Because this could turn out to be quite serious if you don't take both. I'm giving you a strong painkiller. I want you to take 2-4 times a day. Okay. Good.
Lovely, thank you
Good.
very much.
All the best. Hopefully
Thanks.
that'll help. Try and drink as much water as you can. I know you won't feel like it, but fluids are really important.
Yeah. I feel
Good.
sick at just drinking. I've been sipping water.
Yeah.
But
Yeah.
it just makes me feel sick.
I know, but you'll feel more nauseated if there's nothing in your stomach. If it's
Okay.
empty. So try and manage your best, okay?
Lovely, thank you very much.
Yeah. All the best.
Thanks.
You're welcome. Bye.
So, these readings are very high. aren't
Yes.
they? Do you smoke at the moment?
Mm-hmm.
Yeah. How much?
About 20 a day.
Okay.
I'd say roughly about 20.
Okay. Ever thought of quitting?
I've been here once or twice.
Okay. So, I mean, on the basis of this, we definitely need to start a medication.
I hope so, because otherwise I won't be able to have surgery.
Yeah.
Miss Smith had a background of bowel and breast cancer in the past, and she was being planned for a investigation called a colonoscopy to see if there was any evidence of any recurrence of her cancer. She had her blood pressure taken at the hospital that morning, and unfortunately it was very high. And so she was advised to come and see the GP by the anaesthetist to see if potentially she could be started on some medication to help improve it.
There's a tablet that we call a sort of a water tablet. I don't know if you've heard of these types of tablets before.
What is it, water? You mean that you'll urinate more? Because I urinate
Yeah.
way too many times.
So that can be a side effect. The other tablet is something called amlodipine, which is a different type of tablet. It works in a different way.
Mm.
And the main side effect of that one is that it can sometimes cause your ankles to swell, but not always.
Ankles?
Yeah.
Okay.
So perhaps we could try that one?
Mm.
Yeah?
Yeah.
We'd obviously have to bring you back to have that checked again.
Yeah.
Just to see how things are going in about a week's time, say.
Okay, so make an appointment for a week.
Yeah, would that sound okay?
Yeah, that sounds-
Given how high your blood pressure was today, there is every chance that you might need to either increase this or even at a later point give you a second medication for blood pressure, potentially,
Okay.
just to kind of let you know that's how things normally go.
Yeah.
But you might be fine on this tablet, and that may be all you need.
Okay, thank
All right.
you so much.
Take care.
Bye-bye.
Bye-bye.
Come through. Hi, come and take a seat.
Thank you, Jacob. I just have an appointment for checkup. I think I just get this one.
How old is Anthony?
How old he is? He is 5 now.
5 months
Yeah,
old.
yeah.
So why didn't you come for the 8-week check?
I don't know, because we was being Poland, then...
Did you have it there?
No, darling, no, injection.
Has he had any of his injections?
No, darling,
None?
No.
Okay, Agnes, it's very important. The system in this country, it's very, very important that the babies don't miss the immunisations, okay? So we don't like people to start travelling around when otherwise they miss all those things that they need happening. So at 8 weeks, we had to check the hips, the heart and the eyes. Very important for us to do that, okay? The immune cells that mother gives to the baby by the placenta, they start to produce as the baby's getting older. And it's really, really important that we start those vaccinations from the age of 8 weeks. There are incidences where babies do slip through the net, unfortunately, especially in Slough, as we have a multi-diverse population. Travel is very common and therefore appointments can get missed. Is his weight increasing? His weight, has it gone up?
Oh, he's grown up?
Yeah.
He's absolutely fine. My mother, he said he's looked like 1 year.
Lovely.
Yes,
Does anyone smoke in the house?
Yes, we're smoking. No, in the house, never outside.
So you and Dad both smoke?
No, only I'm smoking. He's not smoking.
Okay. Have you been going to the health visitor?
No, I didn't.
To the clinics? No.
No.
Try to go to the health visitor clinics. They're really good. They'll give you advice about feeding, which food you should
Do
start.
I have to go? Oh.
It's better to go.
But I have a second child.
I know, but we need to check the weights.
I don't think so. I will have a time for that. But
Why is that? Are you working?
No, actually, Jacob is just going to school, and I'm just care about with.
No.
my
If you
husband's
ring
father.
them, they can come to your house.
Oh,
Okay.
okay, fine.
We need to start getting weight. We need to get weights done for him as
Okay,
well.
yeah,
Okay.
okay, fine.
Lovely.
Ira Hasnin, please. Hello. Right then, come and have a seat. So, Ira, you're getting a big girl now, aren't you? Yeah? Do you go to nursery or to preschool?
To school.
You go to school?
You go nursery school, don't you?
Yeah. Do you like that? Yeah. Is it lots of fun?
Yeah, we've got a fun day later on today. Fun day.
Oh, wow. So, because you're a big girl now and you're going to nursery, I've got to give you 2 little injections. And do you know why you have to have injections?
I'm brave.
Because you're brave, yes. And because if you get your injections now, then hopefully you won't get sick when you go to big school, will you? And you don't want to get sick when you go to big school because you'll miss out on everything.
All the fun.
Yeah. Okay, so just 2 little injections and then I might have I was brave for the nurse stickers. Yeah, so we'll have a look at those in a minute.
The lion one.
Your lions are very brave, aren't they? Right, you sit on Mummy's lap then.
On my lap then, Ira. So we have this done and then later on we go to the fun day at nursery.
No. That's it, good girl. All right, OK, you look at Mummy. That's it. Yeah, little pinch. Good girl, little sting. Good girl, well done.
It's
Wow.
okay.
Well done.
Oh,
good girl.
That's okay.
Do you want a sticker? Do you want a sticker now?
Do you want Which one did you want? Where's your lion?
Oh, lion. There he is. There, bravery sticker.
Oh, wow, you're so clever. Look, so clever and brave. There we go, one lion, and then maybe you might get another one.
Yeah.
Good girl. Good girl. Wow, you're so clever. Well done.
Good girl. One more little pinch. Good girl. Little sting.
Finished. That's it.
Oh, finished. All done.
All done. All done. All
All
done.
done.
Oh,
Good girl. Well done.
Wow. Well done, Ira. Let's go home and then we go to our fun day, yeah? Shall we go to our fun day? Did you want to have a sticker?
We've got a pink elephant.
That's so nice.
And we've got a koala bear. No? Are you happy with your lion, or do you want one for later, maybe?
I'm going to tell all the teachers.
Yeah? You go and enjoy yourself now.
Yeah.
Yeah? No more injections.
You were so brave. All the children have to be brave, like you. Yeah, you can tell them you were so brave.
Yeah.
Yeah?
Nobody ever wants to speak to me after I've given them injections. All right then, take care. Bye-bye.
Thanks very much. Bye-bye.
Hello, I'm in here today. Come in, have a seat. How are you?
Still getting the dizzy turns, but not quite as often.
Okay. So you've had quite a few. You had some falls when I saw you last time.
Yeah.
What's happened in the 2 weeks since then?
I've had one where I come really dizzy, but I've caught myself, but I haven't landed on the floor.
Right. Okay. And that's it. Just the one.
Yeah.
So what happened? Can you remember what happened that time? When was it, for starters?
It was was on the Sunday.
Sunday just gone.
Yeah.
And what time of day was it?
First thing.
First, what? Straight out of bed, or?
Yeah, but maybe it was slightly quick because I have been sort of sitting on the bed for about 5 minutes before I get up.
Right.
Because of coming over dizzy, sort of taking things much more slowly.
Okay. And when you say dizzy, what's happening?
The room's just going round.
The room's spinning around.
Yeah.
Okay. And how long does that last for?
It can last anything up to a quarter of an hour, and then it'll
Settle down.
Settle down.
Right. Okay. And on that occasion, but on Sunday, you think you got out of bed too quickly?
Well, I did sit there for a couple of minutes, but maybe it just wasn't long enough.
Okay. And then you stood up and you just wobbled and you caught yourself.
Yeah.
Is that right? Does the room spin every morning when you get up out of bed?
No,
That was an unusual.
it's intermittent.
Intermittent. Okay. Is that the last time you can remember it happening?
Yeah.
Is that the only time it's happened since I last saw you?
But yeah, because as I said, I've been really sitting down for a long time before I get up.
Right. Okay. And how do you feel in yourself?
A little bit better.
Okay. What do you think's been causing this?
I'm not sure.
Right. Okay. It's interesting. It's only happened once in the last 2 weeks.
Yeah.
But it happened 3 times, hadn't it, the week before? you
Yeah.
saw it? Yeah. Have you had the recording of the heart?
Yeah, I had an ECG.
Right. Okay.
And the blood test.
Okay. Blood tests are all fine.
Yeah.
I can't see the recording of the heart, so I need to check that out. So I'm a bit concerned about it, really, as to why it should be
Yeah.
happening. It sounds like quite a severe symptom.
Yeah.
And I think that we should actually get you checked out and see what's going on. And I think it should be the heart specialist, because it sounds like a heart thing.
Yeah.
Although the room's spinning around because you're feeling faint and falling,
Yeah.
than it being a balance thing in your ears.
Yeah.
Is that okay?
Yeah.
Can we weigh you?
Yeah.
Sharon came to see me because she has a symptom that she described as dizziness. Her background problem that she has diabetes, but Sharon has a particularly severe form of type 1 diabetes. She also has quite an unusual condition in that she has too many platelets, which are the little bits of the blood that help you to clot if you have a cut. And she's on treatment for that. And in the past, she has had a very severe form of depression that required her to be hospitalised for a short period of time. That was called psychotic depression. That was 9 years ago now, and she's completely recovered from that and had no further symptoms.
When you have this dizziness, are you aware of your heart beating quickly or missing a beat or?
Haven't. I do get sweaty. I don't know if that might be a sign that it is.
Right, OK. Let me have a quick listen to your heart and your lungs today, can I? Listen down here. Yeah, someone's the heart murmur. I'm not saying it is, but we need to get that checked out as being part of this. So, I'll write the heart box and I can see you again, see if we can find out what's happening with this.
OK.
OK? In the meantime, I don't know what else you can do, really, other than exactly as you are doing. When you get out of bed, sit down and don't rush out of bed. When you stand up, it's quite a complex thing for your heart and your cardiovascular system to maintain the blood flow to your head. It's gone from lying down to standing up. It's always got to get the blood to your head.
Yeah.
So it has to take some adjustments. And I think for you, it might be taking a bit longer because of all your other medical conditions.
Yeah.
And therefore, if you stand up too quickly, the blood doesn't get to your head and you fall down. OK. Thanks for coming in.
OK, just bear with me one moment. Let's find you. Friday the 15th. Oh, that's my writing.
Lovely to see you.
Thank you. I'll come and see you in a bit.
Yeah, all right.
Fill you in.
Logan Reed. Are you Logan? This is Hussein, who's sitting in with me today. He's a student. So Logan tells me that he's just had ulcers on his side of his tongue since yesterday.
Yes.
Okay.
He's recently just moved up to the 8 mils of Tippertol.
Yeah.
So we were told to look out for things like that.
Yeah, absolutely. Yeah, good. We'll have a look. When did he move up the dose?
He's been on 8 milligrams since Tuesday.
Okay, right. Okay. How's he doing in himself on the Tegretol?
Yeah, not bad.
Not bad, yeah. So Logan is a delightful chap. He has a form of epilepsy called temporal lobe epilepsy. Tegretol is a very useful medication for epilepsy, but can cause mouth ulcers.
Have you got your big R voice on?
Is big what? Oh, very good. Excellent. You certainly have. You're ready. Is that where your
Well, I only sort of feel it here.
but do you feel it out in your skin, or do you feel it in the inside of your mouth?
Only in the inside
On
of
the
my
inside.
mouth.
Oh, okay, so open your mouth wide. That's right. Really good. Stick your tongue out. That's right. Yeah. Is it that side that's sore? Yeah, very good. And say "oh" again. Fantastic.
Oh.
The number of children who they'll open their mouths, etc., but they won't say that "oh" nice and loud. You know, you could hear that down Slough High Street.
No, you couldn't hear that.
No, that was just a joke. That's good. Just want to look at the inside of your mouth. Well done. Bring your tongue back in, Logan. Yeah, that's good. So just point to me where it's sore with your finger.
What, the jaw?
Yeah, just
The
yeah.
jaw. Where do
Oh, it's the jaw there, right? Okay, yeah. Good. Well done. So I think that, and this is just a viral ulcer,
Yeah.
and I think that it will go after a few days. It's
Okay.
not connected with his treatment. It's not that
Right.
kind.
Okay.
The kind of mouth and we call stomatitis, inflammation of the mouth, with this medication is very clear, is very distinct, causing mouth ulcers.
Yeah.
And sometimes it can be really severe, blisters around your lips and so on. And that's not what he has, but it's the right thing to do to come in. So this is just a virus in his mouth. I'm going to give him something as a mouthwash to
Right.
use and just swill it around, spit it out. Don't swallow it.
You know how to use a mouthwash, don't you? Oh, yeah. Put it in mouth. Swish it round. You don't
Yeah.
swallow it.
Mm-hmm.
That's it. Well done.
That's it.
It's just like bubble gum. You never ever swallow bubble gum. No.
That's right. Do you know what part of the body that is, Logan?
The spine.
Good. Well done.
I can tell by these bits here.
Yeah, that's right. They are, absolutely.
Those bumpy bits that you can
Those-
feel in your back are exactly these.
They are exactly those. That's really good. You know, there's an awful lot of grown-ups who don't know that.
Ah, I see.
So you're doing really well. Logan, nice to see you. Well done. And hopefully these ulcers will clear up. I'm sure they will with this mouthwash. All the best. Bye.
Bye.
Bye now.
See ya.
Mm-hmm.
I really need
Alan Brown. Come on in. Have a seat down there.
All right, you're all right.
How are you? I don't often see you in this capacity. I usually see you in the corridor, don't I?
Well, I'm not a doctor person, really.
Yeah.
I like going to doctors. I think, was it you saw me before about my hernia?
A long while back, because I was looking through the notes, and it was back in...
Well, because I'm such a coward, I didn't do anything about it.
So that's 2011. So when I did the referral, you didn't go, basically? Okay, right.
But a friend of mine died from MRSA.
Yeah.
And although things have changed, I know they've changed, but...
It sticks in the mind. Okay. So what's changed?
It has got much bigger, but what's prompted me, I went to a funeral the other week and a friend of mine has just had both sides done.
Okay. Can I have a look at it again?
Of course, yeah.
A hernia is a protrusion of an organ through its containing cavity. The type of hernia that Alan had is an inguinal hernia, which is where you get bowel contents protruding through a muscle defect in the lower part of the abdominal wall. Was it extending down that far last time I saw you?
It was going that way, but it wasn't. I don't think it was as low. But it's got quite big. And I'll be honest with you. What's quite embarrassing is that in the trousers and shorts, other people are noticing it, and it. See, laying down, it's not as big.
Can I get you to stand up as well, if that's
of
all right?
course.
Yeah, it's more obvious up here then, isn't it?
Yeah, and it's noticeable when I'm dressed, you know.
When you get changed. The pros of treating a hernia is that you can avoid the complications that can happen in the future. So, in other words, strangulation being the one we worry about the most. The cons of treating a hernia include any of the risks of having surgery. So, for example, infection or bleeding or anaesthetic risks. Specifically for hernias, you have something called a mesh repair, and sometimes that can fail, and then you can end up needing repeated episodes of surgery. I think you need to have it done, to be honest. So I'm going to do that referral.
The good thing is I don't get any pain.
Yes.
I've never had any pain with it or anything like that.
Yeah.
It's just there, and it's just not nice.
Yeah, it's getting bigger, isn't it? And
Yeah. So, you know, when you're on holiday and things in shorts and...
Yeah.
It's just not, you know, it's a bit embarrassing, really.
But can you get it back in all the way? Because I could partially reduce it.
I can get it all back.
Yeah.
But the moment that you let go of it...
It comes back out.
It comes back.
The good thing is that you can put it back in. That reduces the risk of it becoming an urgent problem. But, yeah, if it starts getting stuck or it starts turning purple or the pain starts getting really bad, then you need to come and let us know, like, as an urgent issue.
Excellent.
Good. Nice to see you.
Thank you.
Take care. See you. Bye.
Come through. Okay. Have a seat. Okay, so we met before a month ago.
Yeah.
How have you been since I saw you?
Oh, I've still got this thing. It don't look like it's getting any better at all.
No. I remember you showed me last time.
Yeah.
It's darker area of skin. I gave you something called dermal cream. It works for certain patients, and it's very hard to predict with some of the moisturisers. But I think with this condition you've got, at the same time, some other things came up. We were talking about your blood test previously, about your liver, and I noticed you then came and saw another colleague of mine who talked to you about some of the results that you had. So,
last week, wasn't it?
Yeah.
It's pretty scary.
Yeah, the liver has to be checked.
Well, we've got 21st, we're going for a scan.
Okay.
I'm not too sure what it's being scanned for. It's still, I mean, there's lots of words being thrown around, but no one's saying anything that really is definitive about anything. And with Stephen's other issues, I need to be a bit more definitive about what we're actually looking for and looking at, because it is causing problems in other areas of the worry of this, that, or lots of words being bandied about.
Mr. McDonald, one of his main diagnoses is related to type 2 diabetes. He has had some suspicion of rheumatological problems. In addition to that, the reason I saw him was because of a skin rash that he had developed on his leg, which hadn't been clearing away with conventional treatments that my colleagues had tried. What do you understand so far?
All we've heard is autoimmune, we've heard possible, maybe some form of cancer, we've heard all kinds of crazy stuff going on, and it's just not, I'd rather they say nothing and just let us go do what we have to do. But if there is something that's leaning in one way or the other, I'd rather he know about it now, because it is causing problems in other areas.
There's a bit of a jigsaw puzzle here, and we're trying to piece things together. At this stage, we have an idea that your liver enzymes aren't entirely normal, but that's been the case for some time. It might be that in the past it was thought to be due to your medications that were given. you are on quite a few that do involve the liver to help process the medication. So that could be a reason on its own. But until we exclude the other things, we can't just jump to that conclusion.
Right.
Now, what's also complicating this is this thing you've shown me on your leg. When you have bloods like that, we need to make sure you don't have like a rheumatological condition, which can lead to these sort of things where you get skin changes, sometimes you get liver changes. Do you get joint aches?
He has arthritis.
Yeah.
I suffer from
Rheumatoid arthritis. Given that it's not open now, so if I just have a look one more time, and it's relatively dry, I think last time I saw it, it was a little bit more wet feeling. I think it would be reasonable. We could give you a stronger, a sort of steroid cream stronger than what you have with the Lotriderm, but it's just purely a steroid cream. What I would suggest is you can continue using that for the next four weeks. But if it starts to become very weeping and hot and red in that area, then you would discontinue it and you might need to see a doctor sooner in case there's a risk of infection, cellulitis. But otherwise, you can continue.
All right.
And in the meantime, the liver test should come back and then we can touch base if you feel you're not sure where things are going. But I am going to refer you to rheumatology today.
Okay.
All right?
All right, then. Thanks, Doctor.
Okay, take care.
All right, you take care. Thank you.
Michael Murphy, please.
That's us. Thank you. Come on, Murphy.
Hi, come on in. Hi, you're right.
I think we've seen you before.
Yeah?
Yes, we have.
Okay. I've definitely seen you before. Yeah. Yeah. How are things?
Not all too great.
He's getting there. He is getting there.
Yeah, I am getting there, but still, it's kind of hard to.
Still needs his pills.
And how are things otherwise with your mood, with your general mental health? How are things otherwise?
Yeah, things good. I mean, I've had a few little hiccups, haven't I?
Yeah, but it's nothing major. Nothing that you'd be worried that he's deteriorating.
Yeah. So Michael had seen me in the past for problems regarding his mental health, mainly regarding his difficulties with his anger management.
His mental health, since coming out of hospital, has hit a major high for him. It's his attitude towards people.
Yeah.
I've tested him a few times. I've
Yeah.
rung him up, pretending to be someone else,
Okay.
saying that he's going to get in trouble
Yeah.
at work, and
Yeah.
he's like taking it on the shoulder, and he's like, "Okay, that's fine." He goes out.
Whereas something that would normally have got you quite agitated.
He would have been down the
Yeah.
phone, and he's not. So I'm really
Okay.
proud of him for that.
Good. So those things are improving.
Yeah, all together. Yeah, I haven't felt like the urges of punching and all that kind of like stopped and stuff like that. You know, like so I've kind of stopped all that kind of thing.
Okay. It's a bit more chilled out.
Yeah, a lot more chilled out.
Yeah.
So I haven't got so much incredible
Sort of anger.
mini Hulk going on inside me. You know, so it's all cool.
Okay, good. So on this occasion, he'd come to see me because there were ongoing difficulties with gaining and maintaining erections, otherwise known as erectile dysfunction. And we'd agreed to trial some medications to help him with this problem. You can see you've been having the pills for a while, haven't you now? How long?
I've done 2 months. Yeah.
About 2 months. Okay. What do you think? I mean, and welcome to chip in as well. I mean, what do you think kind of was the main thing contributing to it?
His exercise, lack of exercise. That's what I think, because since you've been running, he's... I see an improvement. I see a massive improvement.
Mm-hmm. Okay.
I don't think he does.
No, I still don't feel as confident in certain things, you know.
Erectile dysfunction is very commonly associated with mental health conditions and can sometimes also be made worse by certain medications as well. In Michael's case, given that he had quite a significant background of mental health problems, particularly with regards to his mood, it was quite clear that this was probably the causative factor for his symptoms. But listen, there's a lot of positive things that your partner's saying here.
Yeah, I know.
Yeah.
Definitely know. It's just
there's a lot of good things that she's mentioned today that you should be proud of, from what it sounds like.
I should. But
Yeah. Maybe it's about getting that self-confidence back, actually.
That's probably.
Because what I'm hearing is actually that
maybe a year ago, you were someone who may have flown off the handle quite easily and you had a lot going on. And you seem to have turned the corner a bit.
The thing is, we've just got engaged, so it's like...
Oh, fantastic. Congratulations.
Thank you.
Thank you. High five.
He always wants to high-five someone. I see loads of improvement with him. So it's like, if you can see that from a year ago you've come this far...
Yeah.
Yeah, that's true.
I think you've done amazing. I don't think you need
That's a lesson you have to learn. Always listen to the lady.
Yeah.
She's always right. Yeah.
I don't think you need...
I think as far as that's concerned, I think you need to maybe just look at what's going right. Okay, look at the things that are positive, and focus on those things, and you'll find actually that the other things might follow, and that you eventually might be able to get the confidence and maybe come off these pills. You know, because I think like I said at the beginning that this is probably psychological. Almost 99% this is psychological. That it's your brain that's stopping the lower half from working as it used to.
Yeah.
Yeah. All right.
Okay, that's brilliant.
Brilliant.
Thank you very much.
Oh,
remember, golden rule, always listen to the other half.
Of course, man. Have a nice day.
All right, take care. All right, see you later.
Oh, sorry.